Tremendous strides have been made towards reforming our nation's broken healthcare system. However, more needs to be done to ensure that patients have access to quality, affordable health care, and that nurses are practicing to the full extent of their education and licensure. But who can we trust to help keep the healthcare reform momentum going in Washington? Who can we trust to champion nursing and healthcare issues in Washington? As a nurse, I understand the importance of trust. As you know, in the Gallup poll that's taken every year, except for 2001, when we had that major catastrophe all over the United States with planes crashing into buildings, nursing is the most trusted profession in the country. And I'm really proud that I'm a nurse and that people entrust me with their care. During this election cycle, I would venture to say that who you trust depends on who shares your values and beliefs. Do you believe that all Americans deserve to have access to affordable, high-quality health care? Do you?
Yes.
Yes. Yes. Do you believe that Americans deserve a health care system that removes financial barriers to care and helps those who can't afford?
Yes.
Yes. Do you believe that an adequate supply, and I bet I hear a big yes on this one, of well-educated and well-utilized RNs is essential to making the delivery of health care safe, accessible, and affordable? Yes! The American Nurses Association and Rhode Island State Nurses Associations believe in all those things, and so does Congressman Jim Langevin. Congressman Langevin is a special leader who has dedicated his many years of public service to the federal and state levels to the hard-working citizens of Rhode Island. He has been recognized as a national and party leader on health care, stem cell research, and various health care related issues. And I want to add a personal note to this. When I assumed this position as Executive Director of Rhode Island State Nurses almost 7 years ago, one of the things that I had to do was to establish relationships with our congressmen and our senators in Washington that represent us. And I have to say that Congressman Langevin and his office have been 100% behind any agenda that I have brought forth for nursing and nursing policy in the country. And I would thank you personally for that. Congressman Langevin believes, as nurses do, that health care should be a basic human right. He has also shown a commitment to implementing real change in our healthcare system to ensure high-quality, affordable, and accessible care for all Americans. As you can imagine, Congressman Langevin is also a friend of nursing. He recognizes the vital role nurses play in the delivery of quality health care and understands the importance of educating, recruiting, and retaining registered nurses. Congressman Langevin has also supported efforts to address safe and appropriate staffing and increase funding for nursing programs. And again, I want to thank you for that. Congressman Langevin shares our beliefs and has earned our trust, the trust of nursing in Rhode Island. If re-elected, we know that he will continue to be a healthcare champion for all Rhode Islanders. So it gives me great pleasure to introduce to you a candidate you can trust and believe in, and the current and future Congressman from Rhode Island, Jim Langevin.
Donna, I want to thank you for that very kind introduction. And I really want to say how honored I am and humbled to receive the ANA endorsement again this year. I want to thank you, take you for your leadership, everything you do for nurses in Rhode Island, and to improve the nursing profession, and fight always for better quality of care for the patients that nurses do care for. I think one of the most noble professions in our society, as you pointed out, nurses are always so respected. For better or for worse, I had to learn that the hard way when I was just a teenager and I became paralyzed. And obviously I became intimately familiar with the healthcare system at a young age, and learned very quickly how important nurses are. So proud to fight on your behalf, and again, so honored to receive ANA's endorsement. With that, let me just say, as we all know, our nation right now is in a transformative period with regard to how healthcare will be ensured and delivered to patients. Of course, nobody knows that better than our nurses here in Rhode Island and across the country. And clearly they experience firsthand the miracles that can occur in the tremendous advances of modern medicine. They also experience the many challenges in having a system that's breaking under the weight of its own inefficiencies. So we seize the opportunity to change that by passing the most recent health reform bill in decades when we passed the healthcare reform bill. Of course, that's only the first step on a long journey towards our healthcare system with a stronger, healthier population. And of course, nurses will and are playing a critical role in that transformation. So one of the highlighted areas that we need to talk about always and focus on is a safe staffing levels. Again, first and foremost, we're going to have a healthcare system that promotes quality. We have to have staffing policies at our hospitals that create positive care environment in our nurses and our patients. That's why I'm proud to co-sponsor of RN Safe Staffing Act, sponsored by my colleague from California, that was CAPS, which would staff nurses based on acuity to provide better care of patients while ensuring nurses have a voice in their staffing procedures. Beyond that, though, I have been a strong advocate of nursing workforce development, both nationally and in Rhode Island. At the federal level, I have been a consistent supporter of increasing Title VIII funding that supports, among other things, general and advanced nursing education, practice, and retention, workforce diversity, loan repayment and scholarship programs, and also faculty loan programs. Last year alone, over $300,000 in program funding went to our institution of higher learning and nursing students who will become nursing leaders of the future. We have with us here today, and background here around the world. Let me say that Title VIII nursing workforce education, loan repayment, and other programs were also incorporated in the health and home bill that I'm proud to support. So with that, we also say that in Rhode Island, I held a healthy workforce development forum just last week, focusing on the challenges and opportunities of addressing the nursing shortage in the future. Now, I have also had the privilege of working closely with URI and WIC's nursing programs, as well as at Nursing Middle College, Charter School, Brainchild, Madonna, and other dedicated leaders in our state. So we engage our students from high school all the way up to the doctoral level, provide a pipeline of skilled labor ready and able to enjoy a rewarding career in nursing right here in our state. In closing, let me just say that this is not just about providing access to better care. It's not just about providing access to better care. It is about creating rewarding jobs for everyone here in Rhode Island. It's about creating a path for lower and middle-class families to succeed in any endeavor, free from the concern of falling ill without access to care, and encouraged by knowing that they too can achieve their dream of given the right opportunities. So in many ways, that's what this is all about. It's about fighting for stronger and more robust middle class, because when they succeed, we also succeed. Thank you for all you do.
The endorsement from the American Nurses Association is not taken lightly. The endorsement process is rigorous, and each congressman who is endorsed or senator who is endorsed by the ANA Political Action Committee, Board of Trustees, has a scorecard, and I believe Congressman Langevin's scorecard is at 100% for nursing. Thank you all for coming. You may all go back to class now.
Keep up the great work. We're proud of you.
Thank you.
We're proud of you.